If you click on Prostate Health Sensor, you will come to this screen. Now in this screen you have a number of different chapters that you can look through. First, the introduction will tell you a lot of general information about what is breast cancer, what is prostate hyperplasia, which essentially is an enlargement, how common it is and how severe it is, and the genetic role of prostate cancer and genetics. So in case you're interested, do read through this. It will be interesting general information. Now, going to summary of effects, you will find your summary of your genetic variations. So this first bar here will show you your relative risk of prostate cancer as compared to the general population. So for example, if your bar reaches up to here, you have average risk, meaning that you have about the same risk of developing prostate cancer as the general population. Now, it is possible for you to have protective genes, so genes that actually reduce your risk of developing the disease. If you have more protective genes than risk versions of genes, your bar will be somewhere down here, which means that you have a significantly lower risk of developing the disorder as compared to the general population. It doesn't mean it's impossible, but the likelihood that you will develop the disease is a lot lower in these cases. On the other hand, it's also possible that you might have more risk versions of this gene, which would then add up to a higher risk than the general population. Again, this does not mean that prostate cancer will develop. It just means that the likelihood is a lot higher and that you should change your lifestyle and try to reduce other risk factors that would add to this risk in developing the disease. By reducing significant environmental risk factors, you can reduce the risk and in many cases completely prevent the disease from occurring. Now the second section talks about when checkups are recommended. Generally, it is recommended to do regular prostate exams with a clinician from the age of 45. Now, if the genetic risk is particularly high, prostate cancer can sometimes develop sooner than this age. So we would recommend, if your risk is high, you will see this bar to be a lot higher, that you start with regular prostate exams earlier. Early detection is a very critical aspect of cancer. So usually if you can detect certain types of cancer early enough, there's a very, very high success rate in treating them. Only when it is detected very late and the cancer has had chance to metastasize and spread, then usually the treatment becomes less effective. Now, clicking on the prevention section, this will be personalized data based on your genetic profile. So you might find a different text in your profile. So in this specific example, I will quickly talk you through this individual. He has an increased risk. It might not be the case for you. And I will quickly talk you through the different prevention steps so you get the idea of what kind of preventive lifestyle is important, specifically if you have a high risk of prostate cancer. One important aspect of prostate cancer prevention is a healthy nutrition. The nutritional interventions are a balanced, high fiber, low calorie and low fat diet and the ingestion of plenty of water. Red meat and dairy products or milk products have actually shown to increase the likelihood of prostate cancer development. And as usually prostate cancer develops later in life, it is recommended to cut down on red meat and dairy products after the age of 45, especially if your risk of developing prostate cancer is increased. Similarly, the ingestion of excessive amounts of alcohol have been shown to increase the development of prostate cancer. So this specific individual should particularly cut down on his alcohol consumption, as he already has a higher risk of prostate cancer, and this would only add to it. So after the age of 45, the recommendation is to make sure that alcohol consumption is kept at a relatively low level. Sufficient amounts of exercise have also shown to develop the risk of developing prostate cancer, as exercise trains the prostate muscles, ensures a good blood supply, and thereby reduces the risk of prostate cancer from occurring. In addition, vitamin D, which is created by our own body when UVB rays from the sun hit our skin. So the body produces vitamin D, and this also has been shown to reduce the occurrence of prostate cancer. So a good approach would be to exercise outside to make sure that sufficient sunlight touches the skin, or if that is not possible, or during the winter months, you can also take in vitamin D through your nutrition, which could either be through cod liver oil, salmon, tuna and mackerel, or also supplements that contain a high amount of vitamin D. Besides following preventive advice, it is also important to catch the disease early in case it ever develops. So it is recommended for a person from the age of 45 onwards to go to regular prostate exams from a urologist. A urologist might use a rectal tactile examination to look for enlargement of the prostate, or a blood test called a PSA test, which can actually already recognize early developments of prostate problems in the bloodstream. In addition, ultrasound can be used to measure the urine bladder emptying capacity of the bladder, and this will also allow to determine the status of the prostate and look for any problems before they occur. Finally, you should familiarize yourself with the typical symptoms of prostate hyperplasia or prostate cancer to make sure that you seek medical attention in case you develop one of these symptoms, and allow your urologist to recognize the disease in time. So the typical symptoms that do not necessarily mean that it is prostate cancer or prostate problems, but should be talked to about with a urologist are an increased urge to urinate, especially at night, difficulty in urinating, the inability to urinate, weak or interrupted flow of urine, painful ejaculation, blood in the urine or in the semen, pain in the prostate, severe pain in the lower back, like a lumbar region, in the pelvis, hips or thighs, less strong erection or full impotence, and reduced ejaculation. If you should ever develop some of these symptoms, it would really be advised that you talk to a urologist about it so that he can examine the problems, and in case there is a need to intervene, that he has the chance to do so. Following these recommendations, you will, for one, reduce the likelihood of prostate cancer to ever develop, and should it ever develop, you will allow your urologist to quickly diagnose the problems and get treatment in time. This is very important specifically for genetically predisposed individuals. So you should really follow these recommendations that you find in this section.